Hello guys, welcome to my channel Knowledge About Lab. So from today onwards, we are starting with our MCQ series. This video will be in both the languages, Hindi as well as in English, so that the viewer can easily understand the concept behind each questions. Please make a note of the questions and the topic related to that question. Guys, let's start with our question. The first question is, how can immature eosinophils be described? How can immature eosinophils be described? Options are 16 in size, granules are acidophilic and larger, nucleus is bilobed and it is not masked by granules. Option 3 is 1 and 2 both, and option 4 is none. For your reference, I have also given you diagram. You can zoom it. Yeah, there it is. A mature eosinophil is about 12 to 17 micrometer in size and contain a large acidophilic granules that stain reddish orange with eosin. The nucleus of eosinophil is typically bilobed. You can clearly see in the diagram, meaning it is not completely masked by granules. So guys, both the option is correct. The correct option is 3, 1 and 2. Moving to the further. Next question. Quilling's test is positive with the following organism except. Quilling's test is positive with the following. First of all, what do you mean by Quilling's test? Quilling's test is used to detect capsulated organism by capsule swelling. It is positive for organisms like Streptococcus pneumonia, Haemophilus influenza, and Klebsiella pneumonia. Corynebacter diphtheria does not have capsule, so the test is negative for it. So guys, इस जितने भी स्ट्रेप्टोकोकस निमोनिया, हीमोफिलिया इन्फ्लुएंजा, क्लेबिशियला निमोनिया, कॉर्निबैक्टर डिप्थीरिया, इनके हमें मॉर्फोलॉजी आनी चाहिए. इनके मॉर्फोलॉजी क्या, ये कौन से स्टेन करने पे विजिबल दिखते हैं माइक्रोस्कोपी, इसके रिगार्डिंग भी क्वेश्चन पूछा जाता है. तो गाइस प्लीज मेक अ नोट दैट यू हैव टू स्टडी द मॉर्फोलॉजी ऑफ ऑल दिस नॉट ओनली दिस बैक्टीरिया और स्पीशीज जो भी फर्दर है. ये तो एक एग्जाम्पल है. क्वेश्चंस क्या थे? क्विलिंग्स टेस्ट के बारे में भी हमें और पढ़ना चाहिए, उसका भी नोट्स बना लेना. क्विलिंग्स टेस्ट तो गाइस, तो यहाँ पे करेक्ट ऑप्शन है कॉर्निबैक्टीरिया डिप्थीरिया, क्योंकि कॉर्निबैक्टीरिया डिप्थीरिया में कैप्सूल नहीं होते. जब कैप्सूल ही नहीं होगा तो स्वेलिंग नहीं होगा तो रिएक्शन भी नेगेटिव आएगा. सो लेट्स मूव टू द नेक्स्ट क्वेश्चन. Modified thiamartin medium is most widely used for the isolation of. Thiamartin medium क्या है? It is a selective medium. Thiamartin medium is a selective media used for the isolation of Neisseria gonorrhea. तो थायरमार्टन है जो सिलेक्टिवली चॉकलेट मीडिया है, मेनली चॉकलेट अगार से, कंटेनिंग एंटीबायोटिक्स. इसमें एंटीबायोटिक्स होते हैं. इट इज स्पेशली यूज्ड टू आइसोलेट नीज़ेरिया गोनोरेला विच इज़ अ फास्टिडियस ऑर्गेनिज्म एंड कैन बी इजीली ओवरग्रोन बाय नॉर्मल फ्लोरा. आइसोलेशन मीडियम यूज फॉर, कौन सा मीडियम यूज़ होता है उसके बारे में पढ़ सकते हो. विब्रियो में कौन सा यूज़ होता है वो भी पढ़ सकते हो. ये तो इसी एक क्वेश्चन से हमें और 3 to 4 टॉपिक मिल गए पढ़ने के लिए. तो उसके रिगार्डिंग ये दिस इज टाइप ऐसे क्वेश्चंस पूछे जाते हैं. मूविंग टू नेक्स्ट क्वेश्चंस. A pleural fluid exudates will have a cell count of over dash cells per cubic mm. Pleural fluid is classified as transudate or exudate. An exudative pleural infusion usually has a high cell count, commonly more than 500 cells per cubic millimeter, due to infections, malignancy, or inflammations. The correct option is 500. But this is a theoretical based question, जो आपको पता होना चाहिए. हम कुछ करने नहीं, मतलब याद रहना चाहिए. Moving to the next question. Autologous pre-surgical donation are not allowed for which of the following patient? Autologous pre-surgical donations. What do you mean by autologous pre-surgical donation? So autologous blood donation means the patient donates their own blood before surgery. This is not means they donate their blood before their surgery. So options जो दिए जैसे weight less than 100 lb under the age of 14 with hemoglobin of 13 gram per deciliter or with bacteremia. Among this जो strictly contradict कर रहा है वो है with bacteremia, because this is not allowed in patients with bacteria. Autologous pre-surgical donation is not allowed in patients with bacteremia because the blood may be contaminated and unsafe for transfusion. Low weight or young age may have restrictions, but bacteria is a strict contradictions. So correct option is our So his correct option is So his correct option is with bacteremia. Moving to the next question. Osmolality can be defined as a measure of the concentration of solution based on the number of particles present, the number and the size of particle present, the density of particle present, the isoelectrical point of particles. First of all, what do you mean by osmolality? So guys, osmolality measures the concentration of solute particle in a solution per kilogram of solvent. It depends only on the number of dissolved particles, not their shape, size, or density. So it depends on the number of particles present. So correct option is number of particles present. Correct option is number of particles present. Okay. Let's move to the next question. Okay, this is a diagnostic based questions which is very important for solving Prometric exams, because इसमें से तो क्वेश्चंस आते ही है, डायग्नोस्टिक बेस्ड क्वेश्चंस तो वो पूछेंगे ही. So this is one of the example. 2 of 3 family members had dinner at a local restaurant and within 48 hours experienced double vision difficulty in swallowing and speaking and breathing problems. These symptoms are consistent with which of the following? Option 1, activation of cyclic AMP, endotoxin shock, ingestion of neurotoxin, inversion of the gut epithelium by an organism. So among this option, so guys, देखो पहले तो डायग्नोस्टिक को हमें डायग्नोस्ट जो दिया है उसको समझना पड़ेगा कि 2 of 3 family had dinner at a local restaurant and within 48 hours experienced double vision difficulty in swallowing and speaking and breathing problems. So among this, food poison तो हुआ ही है, ठीक है. तो food poisoning with double vision, difficult in swallowing, speaking and breathing. तो इसका करेक्ट ऑप्शन आएगा इंजेक्शन ऑफ ए न्यूरोटॉक्सिन. इंजेक्शन मीन्स कुछ तो आपने खाया तभी फूड पॉइजनिंग है, तो इट इज एन इंजेक्शन ऑफ ए न्यूरोटॉक्सिन. These symptoms are classically signs of botulisms. The toxin blocks acetylcholine release leading to neuromuscular paralysis, causing double vision and breathing difficulty. His correct option is ingestion of neurotoxin. अरे यार, yeah, correct option is ingestion of neurotoxin. Moving to the next question. Okay, this one is also an important question. Which of the immunoglobulin can cross the placement barrier? Placement. Okay, yeah. Placement barrier is also known as placenta. So which of them can cross the placenta barrier? Basic and important question. The correct option is IgG. IgG IgG is the only immunoglobulin that can cross the placenta. It provides passive immunity to the fetus and protects the newborn during earlier life. For your references, I have also given the structures, antibody complex structures. IgD, IgE and IgG monomer है. IgA is a dimer and IgM is a pentamer. Structures भी पूछा जाता है. On the basis of diagrams, structures भी पूछते हैं कि कौन सी immunoglobulins के structures कैसे होते हैं. मेन तो IgM पेंटामर है. और गाइस इसके रिलेटेड भी हमें नोट्स बनाने हैं, जैसे कि IgA, IgD, IgE इनका स्ट्रक्चर्स, कॉम्प्लेक्स, वेट के बारे में पढ़ना है. Moving further to the next question. A patient differential count shows an elevated eosinophil count. This is consistent with which of the following? अगर eosinophil count elevated है तो क्या होगा? जो ऑप्शंस आर aplastic anemia, bacterial infection, parasitic infection, viral infection. सो गाइज ये भी एक इम्पॉर्टेंट क्वेश्चन है. इसके रिलेटेड हमें और 3-4 पॉइंट्स यहाँ पे मिलेंगे, जैसे कि बैक्टीरियल इन्फेक्शन. ये सबसे पहले जो क्वेश्चन पूछा तो ईओसिनोफिल इज कॉमनली एसोसिएट विद पैरासाइटिक इन्फेक्शन. सो ये है ऑप्शन 3 इज करेक्ट. जो ईओसिनोफिल है वो पैरासाइटिक इन्फेक्शन है. और गाइज बैक्टीरिया या वायरल इन्फेक्शन हुआ तो उसके लिए लिम्फोसाइट्स एलिवेटेड होता है. ये याद रखिए, लिम्फोसाइट्स एलिवेट हो रहा है. तो पैरासाइटिक इन्फेक्शन एलिवेट इओसिनोफिल काउंट, बैक्टीरियल इन्फेक्शन हो या वायरल इन्फेक्शन हो तो लिम्फोसाइट्स एलिवेट होता है. तो बाय लुकिंग एट द हीमोग्राम वी कैन इजीली डिफरेंशिएट द इन्फेक्शन. So guys, thank you for watching this video. If you find this explanation helpful, like the video, subscribe to the channel and comment if you want more Prometric MCQs with detailed explanation. See you soon in the next video.